Gentlemen, let's talk openly about something many men notice after 50 but rarely discuss: potency, stamina, and the confidence that comes from knowing your body will respond when you need it to. Maybe erections take longer to develop. Perhaps firmness isn't as reliable as it once was. You may also notice pelvic tension, urinary changes, or stiffness around your hips and lower back. And like many men, you may have decided this is simply the unavoidable price of getting older. But what if age isn't the only thing worth considering? I'm Dr. Leah, and today we're going to discuss a simple 60-second pelvic self-massage routine focused on an area called the perineum, the region between the scrotum and anus. Why focus there? Because this area is closely connected with the pelvic floor muscles, which participate in urinary and sexual function. When these muscles become chronically tense, some men can experience pelvic discomfort and difficulty relaxing the area. Today, I'll show you how to locate this region, how much pressure to use, which mistakes to avoid, and how to perform the routine gently. But understand this from the beginning. This isn't a proven cure for erectile dysfunction, and more pressure doesn't mean better results. The goal is much simpler: relaxation, pelvic floor awareness, and comfortable self-care. And before we get to the technique, you need to understand the 3 problems this routine is intended to address. To understand why this area gets so much attention, you first need to understand what is happening inside the pelvis. There are 3 major systems involved: blood vessels, pelvic floor muscles, and nerves. First is circulation. Erections depend heavily on blood entering the erectile tissue. The arteries supplying the pelvic region need to respond properly when increased blood flow is required. Factors such as prolonged sitting, inflammation, cardiovascular disease, and poor metabolic health can interfere with healthy vascular function. Second is your pelvic floor. These muscles form a supportive sling underneath the pelvis and participate in bladder, bowel, and sexual function. Here's something many men don't realize: pelvic floor muscles can sometimes become tight while still functioning poorly. Imagine holding a rubber band stretched all day. It's certainly tight, but that doesn't necessarily mean it's working efficiently. Chronic stress, posture, sitting, and repeatedly clenching these muscles may contribute to excessive pelvic floor tension. Third is the pudendal nerve, an important nerve involved in sensation throughout parts of the pelvic and genital region. Persistent irritation or compression of this nerve can cause symptoms that deserve proper medical evaluation. Before you try this 60-second routine, gentlemen, there are several mistakes you need to avoid. The first is using too much pressure. This is a sensitive area filled with nerves and blood vessels, so treating it like a deep tissue massage is unnecessary. Your pressure should be gentle and comfortable. Think about pressing a ripe tomato without damaging it. You want enough pressure to feel the tissue beneath your fingers, but never enough to create pain, bruising, numbness, or an unpleasant radiating sensation. The second mistake is massaging dry skin. Excessive friction can irritate the surface, so if you choose to use an oil, use a small amount simply to allow your fingers to glide comfortably. Stop if you notice irritation. Third is expecting immediate results. Don't perform the massage aggressively because you want something to happen faster. The purpose is relaxation and pelvic awareness, not forcing a physical response. Fourth, choose a comfortable position. You can lie on your back with your knees bent or sit securely near the edge of a chair with your feet supported. Your hips, abdomen, and pelvic floor should feel relaxed. And finally, don't turn this into something you perform only before intimacy. That can create unnecessary performance pressure. Instead, think of it as a brief relaxation routine. Now, let's locate the area correctly. The perineum is the region between the scrotum and the anus. For this routine, the focus is on the soft external tissue in the central part of that area. Start by getting comfortable. One option is to lie on your back with your knees bent and your feet supported. This position can make it easier to relax your hips, abdomen, and pelvic floor. Another option is sitting comfortably near the edge of a sturdy chair with your feet flat and your knees slightly apart. Using clean hands, gently feel the external perineal area. You don't need to search aggressively for a mysterious million-dollar point. The goal is simply to identify the soft tissue between the scrotum and anus without causing discomfort. This region lies close to important pelvic floor muscles, including muscles involved in sexual and urinary function. It is also an area containing sensitive nerves and blood vessels, which is exactly why gentle pressure matters. If you use an oil, apply only enough to reduce friction. Warm it between your fingers first rather than applying anything excessively hot. And here's your rule. Tender may be acceptable, but pain isn't the goal. If pressing the area causes sharp pain, burning, numbness, tingling, or pain that travels elsewhere, stop. Now let's get into the actual 60-second massage technique. Once you're comfortable and you've located the perineal area, start with clean hands, and if you prefer, a small amount of oil to reduce friction. For the first 5 seconds, gently spread the oil across the external skin. There should be enough for your fingers to glide comfortably without making the area excessively slippery. For the next 5 seconds, place 1 or 2 fingers over the soft central area and apply gentle, comfortable pressure. Remember the ripe tomato rule. You should feel pressure, but you should never be pushing through pain. Now spend approximately 30 seconds making small, slow circles. Move clockwise for about 15 seconds, then reverse direction for another 15 seconds. Keep your breathing slow and allow your abdomen, hips, buttocks, and pelvic floor to remain relaxed. For the final 20 seconds, switch from circular movement to a gentle press and release pattern. Apply comfortable pressure for several seconds, then release completely. Repeat without forcing the tissue. That's your minute. Don't press harder because you think it will improve the effect. And don't continue if you experience sharp pain, burning, numbness, tingling, bruising, or pain traveling into another area. The purpose is gentle external massage and relaxation, not attempting to manipulate the prostate itself. So, gentlemen, how should you use this 60-second routine? The key is to keep it simple, gentle, and separate from performance pressure. Choose a neutral time when your body is already relaxed, perhaps after a warm shower or before bed, rather than saving it only for moments of intimacy. I'm Dr. Leah, and I want you to remember that consistency should never mean aggression. 1 comfortable minute is enough. Don't compensate for a missed day by pressing harder or massaging longer the next day. Think of this as basic pelvic self-care. Relax your breathing, release unnecessary tension through your hips and pelvic floor, and use gentle external massage if it feels comfortable. But there's an important boundary. If you're experiencing persistent erectile dysfunction, significant loss of genital sensation, ongoing pelvic pain, worsening urinary problems, numbness, or severe lower back symptoms, don't assume a pressure point will solve the problem. Those symptoms can have different causes and deserve proper medical evaluation. And if massage itself causes pain, burning, tingling, numbness, or worsening symptoms, stop doing it. Your health after 50 isn't about desperately chasing every quick fix. It's about understanding your body and responding intelligently when something changes. If you found this helpful, like the video, subscribe, and share it with another man over 50. And tell me in the comments, have you ever tried pelvic floor relaxation or massage before?